Hi everyone, it's Dr. Zach Borus from Dickinson County Public Health and Lakes Regional Healthcare in Spirit Lake, Iowa. It is the 11th of May, and it's been a couple weeks since we've done one of these, so I just wanted to give you an update. I am going to take off my mask because Jennifer is more than 6 feet away, but just wanted to touch base about some statistics, what we are doing here at the hospital, sort of our position right now in my personal position on how we're opening back up in Iowa, and just some tips. So thanks for taking the time to chat with me. We are at nearly 12,000 cases in Iowa confirmed. Obviously there are going to be many more than that who have not had symptoms and who have not gotten tested. So 11,959 as of this morning to be exact. We have had 265 deaths. Dickinson County is still stable at 6 total cases, and all of ours thankfully have recovered. However, it's all around us too. And some of that is also based on reporting. So there could be someone who is in our county staying here who has an address elsewhere. Certainly as we get into the tourist season, there likely are going to be people who are positive who are coming here. So we fear that that's a little bit of an underestimation, but thankfully we have no one in the hospital. We have no one who is known to be ill in the county. But up in Jackson County, there's 32 cases. Over in Sioux County, there's now 84. Up in Nobles County in Minnesota, there's 1,200. So it is still growing. Woodbury County, down where Sioux City is now the fastest growing county in the country in terms of number of cases per capita. So not a great distinction that they want to have, but it's very close, and we are hoping that it doesn't come here. In the U.S., we're up to 1.36 million cases confirmed, over 80,000 deaths, and that's, again, more than the Vietnam War, and this is in a month and a half. So it's been fast, it has been tons of people. And now, as we have seen relaxation of social distancing guidelines in various states, the estimates in terms of how many deaths we might have in the U.S. are going up by the day as well. So, whereas the modelers from Washington State were saying perhaps 80,000 to 100,000 deaths, actually at one point it was 60. Once things started opening up, they doubled that. So it is now up at 137,000 deaths, up from 134,000 deaths 2 days ago. So how we're acting and how we're opening up does have an impact on how many folks will die, and it's a balance. So we're just trying to figure out the right balance of how we continue to keep our economy open and how we continue to make sure that folks aren't going hungry, and that people are working with more people getting ill from this disease. So what we need to do is be protecting everyone. So I want to take a moment to just talk about masks. So, this is a cloth mask that my mother-in-law made for me. Thanks, Barb. This is the best thing that you can be doing outside of here unless you have a medical grade mask that you already own. So this mask protects people who are near me from me. So if I'm walking around with no symptoms, or maybe with a little bit of a cough or something, this mask helps them not get sick from me. It does not really help me much from getting sick from them. So really, masking is about everybody wearing them. It's still the CDC guidelines and recommendation for everyone to wear a mask in public where they're not able to fully socially distance. Still, we're seeing a lot of folks out there who aren't wearing them. That is your choice. Nothing is required, but we still strongly encourage it. And at the hospital we have lots of folks who have donated masks. So if you need one, just come to the door of the hospital and ask for one. We should have supplies. If we don't on one day, then we'll have more the next day most likely. So thank you everyone for your generosity and for your work making those for us and for our community. But we want to keep everyone safe. So, if you are in line at the grocery store, you might see that your checkers are wearing masks. Again, that's to protect you from them. But, they're at risk daily with hundreds of folks walking by them. So please do your part too and wear a mask to protect them, because they really are essential workers, and they can't always be 6 feet away. So we are still recommending here in Dickinson County that once you come up for the summer to be at your lake house, to be at one of the campgrounds, which are now open, we are still recommending trying to stay in your space for 14 days if at all possible. If you do have to go out, then wearing masks. But really, still, there's grocery delivery services. There's still iglcoronarelief.com.org actually, which can have someone volunteer to bring stuff to you to help you out if you need it, to help open up your house. I mean, any type of help that you might need, it's there. So please use it, and please be respectful as you come back so that we can all stay healthy. So since we last talked, the governor has relaxed social distancing guidelines and has started to open up businesses, and we're all adjusting to that. We think that we're trying to find a new normal. Here in Dickinson County, as a tourist attraction and as a place where people come to have fun and to go out, we still are quite concerned that we may become a hot spot. So remember that if you are sick or if you know that you've been exposed, it's okay to cancel your plans before coming. Or if you are coming, then please stay isolated in your hotel room, in your resort, in your cabin, however you're doing it. But please do be respectful so that we don't have a large spread here. You are allowed to go out to restaurants now. You are allowed to go, some of them are bar-like restaurants. So the governor put in place some pretty wise guidelines of, all the tables need to be 6 feet apart. You can't have more than 6 people at a table. But please make sure you're following the rules. We've driven by a number of bars and other places where it's clear that people are probably packing in around the bar. That's not illegal, but it is still not recommended. So try to keep some space. If you do have to go out, wear a mask to protect people from you, even if you don't think that you have symptoms, but especially if you're coming from somewhere like Woodbury County, you are bringing a higher level of risk here, and we really want to save our summer. We really don't want to see a big spike and then have everything closed down just when things are usually getting underway in June. And also, we want to make sure that everyone here stays healthy so that we don't lose any residents and so that we don't overwhelm the local healthcare system. On that front, the healthcare system, things are changing here too at the hospital and the clinics. So whereas we have been very restrictive, and I think appropriately so, in terms of what we have been doing both at the hospital and at the clinics, the types of folks we are seeing, surgeries, etc. We're now starting to try to find some level of new normal and opening things back up in ways that we think are very safe and that are pretty thoughtful. So in terms of the hospital, we still have visitor restrictions in place. You will still be screened when you come to a door. You will still be asked to put on a mask, as will all staff that you'll see be wearing a mask and some sort of eye protection as well. But once you come in, we are starting to schedule some outpatient surgical procedures. This is not stuff that's going to use a whole lot of personal protective equipment. This is not stuff that's going to likely result in a long hospital stay, which would utilize resources that we might need if there is a spike in COVID. But we feel that we have enough supply and enough preparations in place that we have the ability now to start doing some procedures. So knee and shoulder scopes are probably going to go ahead. Perhaps some outpatient abdominal cases like hernias and things like that. But we're still not doing total joints. That just takes too much staff, takes too much personal protective equipment, takes almost always a bed in the hospital. And even though the hospital's finance folks would love to be doing those things, we want to keep people safe and make sure that we are prepared in case something does develop as the summer goes on. That will change as well over time. We may start doing stuff. We may, if we do see a spike, cut it off again. We have pretty clear guidelines as to if our supplies of protective equipment go up below a certain level, or if our hospital bed availability gets too low, we're stopping those procedures for the time being. So we are booking on a 2-week increment chunk right now, and we think that'll allow us to keep people healthy while also getting some of these procedures going that people have been waiting for, and thank you for your patience. Mammography is going to start up again next week. We're going to be prioritizing those who have short interval callbacks, so people who are high risk or who have needed 6-month follow-ups, but then you will be able to schedule your screening mammograms again. Still waiting on DEXA scans and a couple of other outpatient screening procedures for now, but that may open up. So that's sort of what's going on at the hospital. So we have the capacity, and we're pleased. We're pleased to be able to offer those services again. At the clinics, we are still very much separating out anyone who has symptoms of COVID, so fever, cough, shortness of breath, and then some of the expanded things too. So if you have, you've probably seen that some of the symptoms have changed. So if you've had a sudden loss of smell and sore throat, and sometimes with GI symptoms, if you've had 2 of those, you may also be sent to the respiratory clinic as well instead of the well clinic. But those are in one space. Everyone who goes there has the potential to have this, and that's where you can get tested. Everyone else, whether it's coming in for a med check or a prenatal check or a baby check, or heck, I think I've got a urinary tract infection or I've got a cellulitis, we want you to call. We have the capacity to see you in a safe place. So if you've been putting off that checkup that is now months overdue, we may ask you to come in instead of doing it remotely or just continuing to push it off, because that's not good care for your chronic illnesses to not be checking on your diabetes control. So as of today, we are now open to all types of appointments rather than just the urgent and acute, as well as the little babies and prenatal visits that we were seeing. So it's expanded somewhat. You will still be screened when you come to the door. You will still have a mask on. We have a lab that is completely separate from all other patient care sites, so we might ask you, after you've scheduled your appointment, we might still have you do it by telemedicine, because it's still lower risk to do that than come here. But we may ask you to do your labs at this safe lab location first. So lots of things are changing. We are pleased to be able to continue to see more people. And again, if things heat up here, we will back down to the just urgent visits. We hope we don't have to do that anytime soon, but it is possible. So just as before, the estimates here in Dickinson County and in Northwest Iowa are that the peaks will probably be in June in terms of the number of cases we're seeing of coronavirus. We still worry that the number of those cases is going to be higher than it would have been before relaxation of social distancing guidelines. But I think we are able to handle it here and with our referral partners in Sioux Falls and elsewhere. So I think we're ready. We are in a whole new world. We are learning how to do this in a safe way so that we can get chronic illnesses taken care of, get surgeries taken care of, while also keeping everyone safe and also making sure that the coronavirus does not spread as much as it could. So make sure you wear your mask. Make sure you still, if you have folks who are in a high-risk category, so people over 65, people who have chronic illnesses like diabetes, high blood pressure, I would still encourage all of those folks to continue to self-isolate as much as possible. And if they are in your family, make sure you're wearing a mask if you absolutely have to see them. But really try to continue to self-isolate from them and connect in other ways like Zoom and FaceTime and everything else. We're here for each other in the community. We appreciate everything that everyone has been doing. We appreciate your ongoing support of the medical staff and community, and just keep taking care of each other so that we can all enjoy a happy, hopefully healthy summer, and so that this doesn't get worse than it has been. We're in a pretty good spot right now, but things can change rapidly, as we've seen. So don't let your guard down. Continue to wear a mask to protect other people from you, and stay healthy, stay safe. Thanks.